Good afternoon, everyone. My name is Patrick Dunn. I am the Executive Director of the New Haven Pride Center. Thank you for being here today as we explore health equity in HIV and AIDS. Health equity is obviously a very important topic when it comes to LGBTQ community, as we have many challenges with the health community and larger network of healthcare providers. We are excited to continue to have conversations around health equity. You might have seen our conversation last month around trans health equity. We also hosted several conversations both during Pride in September and last June around this topic as well. But today we're focusing on HIV and AIDS healthcare and how we achieve better equity for patients and for us as a community. Today's program is part of the World AIDS Day Observation Program here at the New Haven Pride Center that we're hosting in partnership with the New Haven Mayor's Task Force on AIDS and Guardian Health Association. If you'd like to know more about all of the programs happening this week, you can go to newhavenpridecenter.org/World AIDS Day. Now, I'm going to stop talking because nobody here came to listen to me talk. So I'm going to bring up our first guest, which is Nadine. Hi, Nadine. How are you?
Hi, how are you? I'm fine. How are you?
I'm doing well. Nadine, can you tell everybody a little bit about yourself?
Oh, I'm Nadine Ruff. D. Simone now, just got married. I have a master's degree in social work. I'm a program coordinator for APNH, a place to nurture health for people 50 and over living with HIV. I'm a woman with a transgender experience, and I've been living with HIV for over 33 years.
Thank you.
Is there anything else you would like to know?
Well, I think it's important to say that you're also a Dorothy Award honoree, and you're about to get another award tomorrow night. So
yes.
overall, a pretty kick-ass person.
Yes, I received the Dorothy Awards last year, and I'm about to be nominated for the Elsie Cofield Award tomorrow. And also that I'm a founder and a facilitator of a transgender support group called Divinely You as well.
Yes, fabulous, amazing support group here in Greater New Haven. Second, I'm going to bring up Dr. AC Demidont. Hey, AC.
Hi. How are you?
How are you? I'm good. How are you?
I'm okay. AC Demidont. I use she, her pronouns. I've been around for a little bit. I am an infectious diseases doctor. I started and founded and used to run Anchor Health Initiative. Now I work for Gilead Sciences as the medical scientist for HIV prevention covering New England. And I have been working in the field of HIV since the mid to late 90s, and have been an activist, advocate, positive person, all those kinds of things for a long time. So, that's me.
Patrick, are you froze?
Bye, girl. Could you hear me? Did we disappear or did
I heard you.
Did we disappear or did he?
No, we are here, okay. But where's Patrick?
Because my thing was, I don't know. Are you sure we're here? Because my thing was busting up. I'm not sure.
Let's send it. Hello? Oh, Jesus, Jason. I don't know what happened here.
Are we backstage again?
I don't know.
I'm going to mute myself. I'm going to go out and come back in.
Oh my gosh, I'm so sorry.
What happened?
My internet dropped. Are you still there?
Yeah, we're still here.
It's like there's a choppiness to it. I don't know what.
I'm on Maya's hotspot right now. Well, live TV, yay!
Yay.
AC, I don't know if you ended up finishing introducing yourself, but do you want to go again?
Yeah, I'm done. I'm not sure what was heard, what wasn't, but I'm sure we'll catch up to it later if we need to.
And Dr. Chris Alonso, you're sitting at the bottom, and I don't think you've got to say anything yet. Oh no, I can't hear you.
I'm kidding. It's not muted. I'm just playing. Hi. My name's Chris Alonso. I'm a primary care doctor. I used to be based in New Haven for training, where I did like an HIV specialty for primary care, and now I'm up in Boston, where I work at an LGBT healthcare clinic where I do primary care, HIV care, substance use management. I used to be on the planning end of things for events like this with Patrick some years ago, so it's nice to be on the other end of things for once. A lot less stressful, if I do say so.
Yeah,
that's it.
Yeah.
That's me. Happy to be here.
Okay, well, now that we're all here and internet is seemingly working, if I disappear, feel free to keep chatting. So I guess my first question that I want to start with was a really general question, which is to have each of you talk about your commitment, what the root of your commitment to HIV, AIDS, healthcare is, and what drives you to work in this area, in this field. And we're going to make this is going to be popcorn style, so anybody can go in.
Ladies first.
Sister Demidont, you want to go first?
Okay, I mean, whatever. You know, I grew up in the 70s and 80s in Philadelphia, and, you know, we didn't, as a little queer kid, and the only thing I knew about HIV was that you were going to get it and die like Tom Hanks in the movie in Philadelphia, and everybody was scared, and it was a really scary time. And so I think for me, I always say I was kind of like a naughty by nature kind of girl. And so I always just really wanted to somehow learn how to it just fascinated me and terrified me at the same time. And things that I'm like really scared of, I tend to like try to learn how to control and learn about. So I was smart enough to be able to get into medical school. And then I knew going to medical school that I wanted to be an HIV doctor and an infectious disease doctor. And so I went to medical school in Philadelphia. And then, you know, I moved to New York afterwards to do HIV. And I think what solidified it for me was I was in college and we were forced to do I was forced to do community service. And I had to go to this an AIDS hospice because they had them back then, right? That if you got HIV, you died. And so I worked for 6 months where I went and I read, her name was Wynn, and I read to this woman who eventually ended up dying of AIDS. And I remember thinking like, you know what, girl, like you can do something about this and you can change like at least some, like I couldn't do anything about her except read to her and give her food. And like, what could I do for using some of the gifts that I had? And so when I got from the minute that I started, everything that I've done in my career about research has been around prevention and biomedical prevention and ways to use HIV medications to prevent HIV infection, whether it was after an exposure, because I'm old enough to that, like you, like even post-exposure prophylaxis for sexual exposures didn't exist at all when I was in started training. So, you know, for me, what drives me is that I don't want the little queer kids growing up today to have to live in the same fear that I had when I was growing up, about HIV at least. We got enough shit to worry about as LGBTQ people in this country. And at least we should have a little peace of mind that we can protect ourselves from not getting HIV. Because I can tell you, it sucks getting old with that shit. I can tell you that. You know, that's kind of what's driven me. And from the prevention stuff, let me tell you, for many years, we would go to I would go to conferences. There would be like a handful of us that would keep saying, no, we got to keep giving people medicine. It's going to work. It will prevent them from getting HIV. And they'd be like, you promote barebacking. You're filthy. You know, you promote people being sexually promiscuous. And I was like, I don't need to promote anything. Barebacking is doing fine on its own. Like, everyone loves it. Like, they don't need me to support it. So, you know, I think that's what's driven me to do it, is watching people die. It's good. And I don't want kids to have that same fear. Sister Nadine.
Thank you, Sister Demidont. Well, for me, I was diagnosed in 1987. So I watched plenty of people die that was close to me, and you know, it was right when in the smack when it really came out, and I watched friends, family members, and then, like, you know, once I realized that I was HIV positive, and I just felt like there was something I needed to do. And once I lost my brother, and then I knew exactly I had to do something. What was it that I didn't do to help him stay alive? You know what I'm saying? And I can remember, because back then, like, I think a lot of people were using substances just to hide away from the fact that they had HIV, and that's how many of us contracted it. And so, like, I knew that my brother had did the same things that I did, but he was afraid to be tested. You know what I'm saying? And I was tested. From my history, I would end up in jail, you know, from doing sex work and stuff like that. And I ended up in jail, and that's how I found out. And so, like, I realized, like, you know, I didn't want to. I did in the beginning. I just didn't want to accept it, but I had no choice but to accept it, you know. And mentally, it did a number, and I can understand how other people felt. Like, you know, that here you have this disease that's going to kill you, you know, and so we have these new drugs that came out that's like it was taking people away. You know, what was it, AZT? I was watching people take AZT, and they were just dropping like flies. And so I made a decision that I wouldn't take it, you know, and until they came out with something new. And they finally came out with something new, and still people were still in a state of shock or having the stigma about being HIV positive, and they wouldn't come forth. And so, like, what drives me to help is to, like, you know, not just me being positive, but also trans people being positive. And you know, it really is a real pet peeve for me. Like, you know, to let people know that, yes, you can be positive. And now today we got tools, you know, and so I advocate that we have tools. U equals U. You know, if you're undetectable, you're untransmittable, and so to take the bite out of some of the stigma, you know. But, like, you know, the group that I work, I'm a program coordinator for, like, we're still stuck in that stigma. A lot of people still stuck in the stigma, and so what, like, I try to do is advocate for the positive tools that we have today, like, you know, and so I want to bring people that's been living with this HIV for such a long period of time, who caught it in the 80s or the 70s or in between those years, and still were living with that fear about people knowing about them HIV. I like to bring them up to today's date, and so I continue to advocate and to promote, anything that's going to help us to get to a different place from the beginning when HIV started until where it is now. Because like I watch a lot of people pass away, and I sometimes have that survivor guilt, realizing like, why am I still here? And I guess one of the reasons why I'm still here is to do what I'm doing now. And so like to advocate for people, trans, and anybody who's HIV positive. Like you don't have to die from it today. You can live a wonderful life, and be as beautiful as me. Uh-oh, are we going again?
No, I'm here.
So those are some of the things is why I do. Like I advocate because like AC said, like, I don't want to see another young person, get this disease and feel like there's no hope. Because there has been a lot of people who killed themselves behind this disease. And like my thing is for right now is why I fight so much is for my community, people of color. Like we're the last ones who's getting, if we're going to get to zero, then we got to touch those communities as well. You're not going to find a cure. If you don't get into the communities, we're not at the gay bars. We're not at the, what I'm saying, and we're not at these high places. So somebody got to do the work to get into these communities to help put an end to HIV and AIDS, and I like to be one of those persons to be that one to do that.
Chris, before you answer the question, I just want to reflect really quickly something that you said, Nadine, and that is that the very similar thing came up in our conversation on Monday about the kind of the early days of HIV. And one of the things that really has stuck with me this whole week that Karina Danvers said was people who think about outreach today don't understand what outreach is around HIV, because like in the 80s and 90s, you went out and just sat on a street and talked to people and handed out and like that's how. And, and when you're talking about people not being able to get it out to the communities that are really the most vulnerable, you're 100% right, because we're so fixated on this kind of one way of doing outreach that doesn't work,
And it's not working, and we'll never get to zero. If it's not how they say that all life, not just Black Lives Matter, all lives matter. People with HIV matters as well. So I figure like if we're gonna get to zero, we got to come together as a team. You know what I'm saying? The people at the bars, they already got it. They got the information. They're doing well. Now we got to get these other people who's not doing well. So we can have a cocktail after we get the people who's not doing well. We can go back to the bar and have a cocktail. But now the work is we're getting these people in African American cities and stuff like that, and people are not able to get the information that we have that's available. And so I think that we need to talk. We have to have more communication about how we're going to make that happen. We have funding for it. You know what I'm saying? We can. The fundings is made for that particular thing anyway, but we're not reaching them. So there's a problem if we're not reaching them.
Chris, how about you? What drives you?
Oh boy. I mean, besides the the whip that we have back here, just constantly getting me to do things. I think for me, when I first got into medical school, I think that I'd had the experience of growing up in the 90s, and you see a lot of the stigma that was around HIV, and you have no idea what it is because you're a kid. But you see the fear, and you see the avoidance, and the glances looking away, and the way that they talk about certain people, and never really understanding that growing up, but knowing that it was sort of wrong, and then getting into medical school and actually learning, this is actually what this is, and this is what it means, and this is why it's affecting communities disproportionately, and then coming out in med school and realizing this is me. This is my community, identifying as a Latino, a gay guy, and these are the communities that were getting hit, and I was just oh my God. And so that, I think that's sort of kind of what kicked my interest into infectious diseases. And then a lot of my training focused on doing rotations within infectious disease, HIV care, outpatient, inpatient, doing outreach into areas of South Texas where access is really poor and the populations are predominantly 90% Spanish speaking, and they don't have access to care or use interpreter services. And the thing that drove me is that, like, this is my community, and I know what this is. I've seen what it was growing up, and I don't want this to happen anymore. And part of the thought was that, well, is it being seeing somebody like me in a clinical setting, is that something that's going to be helpful? And being out and identified and Spanish speaking and saying all of these things to try to like bring people in and say, hey, like, I'm your guy, you can come see me. I know where you've been, I know what this is, and I'm going to be accessible for you. And I think that's a big driver for me, because I want to identify myself in those ways so that people in these communities will say, okay, like, we know that guy. This isn't like some old silver-haired guy who doesn't know what he's talking about, never really dealt with it, doesn't know the experience. Because I think that means something to a lot of people, to be able to say, like, I know that this person relates to me. And I think that changes the entire dynamic of how you provide care for somebody. And then I think, kind of going through my training, at Yale with the HIV program, and I say this loosely because I don't think I'm an expert by any means, but, I've spent, the greater part of like 8 years learning how to do this kind of medicine. And, I do it every day. I do it on like large scales, and, we keep up with all of these innovations. And really, I think the tone with HIV is that it has changed so much. There is so much innovation. There is so much light at the end of the tunnel. And I think that once people are able to sort of plug into care, that's it. Like, we do such a great job of being able to provide this care in a holistic and unified manner that really addresses so many different aspects of this, or at least I hope most places do. But I think that one of my most rewarding experiences, actually, and this happened sort of in the clinic a few weeks ago, but it was a patient, had a new diagnosis, thought the world was over, kind of like Nadine was saying, like, they think their life is over, it's going to end, like nothing's going to be the same forever. And, when I initially met this person, that was the story I got. And I'm like, okay, like, let's feel these feelings, let's go through this, but let's also do the work. And a year, like not a day to the year, I was like, let's reflect on where things are from now and from where they were a year ago. And this individual was like beaming, like they're starting a new relationship. They've talked to their families about everything with like disease management looks fantastic. Like, we're doing so well. Like, HIV is like the last thing that this person is ever going to think about, because we can do so well. And I think that the other thing that really gives me a lot of hope that keeps me going with these things is seeing all of these innovations and outreach and changing from going out to the bars and giving out condoms and like, rallying. And, now we do live streams. Everybody has a cell phone that can tune in, and they have like at their fingertips access to see people talking about this, knowing things are accessible, knowing that they can get help, knowing where to go to find people, and seeing people like themselves. And it's so easy. And I know TV is such a moot thing, but there are TV shows now that are highlighting the onset of the pandemic of HIV, and people are seeing people like themselves, all different races, genders, color, non-binary, trans-identified. And it's creating those spaces in home environments for people to actually see that, relate to who they are or what they're feeling, and open up those dialogues. And it's a way to do it that we've never ever had before. And I think this innovation is wonderful, and I'm very excited to see how it goes on further and further, because I think we're going to start reaching those people that like AC and Nadine are talking about. Like, we have better access points, and I think that they're going to start using them. And that's it.
Hopefully they're going to start using them. I can see Nadine's face.
I've been waiting for years. No.
So I'm going to go, and I think all of you are probably going to answer this from a very different perspective. So my next question is really, what do you see as the greatest health inequities and barriers to either those living with HIV or those who might be highly at risk of contracting HIV?
Well, I'll go. Like I mentioned earlier, we have a lot of stuff that's could help people who's HIV positive. But the barriers that I see is like they're not reaching those communities that's suffering, and that's the barrier. I don't think that we have come up with a scheme or a plan to where we can go out into those communities. Like we have the plans where going to the bars and going to colleges like that, but I haven't seen, and I'm not just here when I go to a program like a program like NMAC, and it's not just here. It's just not here in New Haven. It's at every major city. So like, there's something we're not doing. And I think that's where the dilemma stands. If we're doing the same thing when we're getting the same funding from here in Connecticut to Washington to to the West Coast and all that, and we're still facing the same dilemma, something is wrong. There's a breakdown somewhere where we're not reaching these people to get us all to zero. So I think we need to come up with a plan. You like Chris was mentioning, get people that's like us to go out into these places. They would be more comfortable accepting that information from a person that looks like them than a person that doesn't look like them. So if you don't have those people in your organizations, it's easy if they go to a doctor, it's easy to get someone. Get someone to go into these neighborhoods, even if you have to pay them, because like it have to start somewhere. It have to start to where, if we're going to get to zero, it's never going to get to zero if we're not reaching these communities. We can preach about it all day long to the sun goes down, but if it's not being done, we're not going to get to zero.
And I agree with Nadine, and I think sort of the anchors of this problem are at least two things in my opinion. I think it's stigma. And then also the other thing is going to be access to clinical care, because I think that there's a certain stigma that people are worried about. Like, I work at the big gay clinic in Boston, and if people want to go there to access care, like they know, oh, this is probably like a safe environment to talk about these things. But what if somebody sees me walking in?
Yeah.
Like, what are people going to think if they see me going into this place, or doing PrEP at the Nathan Smith Clinic? Sure, like that's where we were doing PrEP as a resident clinic in the majority. But what are people going to think of me if I walk into the Nathan Smith HIV clinic and come out with prescriptions? And so I think sort of breaking down the stigma of like what that means to seek that care, but then also transforming these other locations into like as competent as they can be to kind of access and address these things. One of the things I always thought was really interesting is that whenever I would do my away rotations at Yale to like other little clinical sites or like, private practices, talking about things like PrEP or sexual histories or, getting into these things, it was always kind of like, oh, we don't do that. And it was like, why? Or it's easy, like the information about PrEP and the information about sexual health, like it's really available. It's very accessible. I promise everybody's doing it. And, like these are things that we should feel comfortable getting into. And really, it just takes a little bit of education to make these providers at these clinical access sites so much more competent. And I think it's just a matter of going in, doing some like good directed training that is accessible and easy. And it's going to make accessing these clinical sites less stigmatized and make the process a lot less stigmatized. And they're going to be in communities that everybody lives in, so that they're not having to like drive to New York to get this kind of care done or drive to Boston to get this kind of stuff done, because it's in your backyard.
And I think we also have a thing with, trust, because I know a lot of people of color, they don't want people to know their business. You know what I'm saying? And so like we got to get past that barrier. So we're like, is everybody business if you're HIV positive? Not really, but really, because like you need to know that if you are positive, there's plenty of things you can do. So like pretty much we are our brothers and sisters keepers.
So look, I worked in Manhattan to do this work. The same thing. People still didn't come. They still didn't go on medications. They still didn't take their medicines because they did not prioritize healthcare as their top priority. I came to Connecticut. I said, you know what? I need to take this to Connecticut. They just need it out in the country. They need to get these, like, you know, we need to educate people. Nobody changed. I sat on the Getting to Zero Commission for the state of Connecticut. We wrote this wonderful, fantastic report that nobody pays attention to, and nothing is changed. You know, there needs to be so stigma by far, to me, is the reason why this continues, is because you are allowed to, as a medical provider, still say, you know what, you're transgender, go away. Like when it comes to HIV and trans people, the fact that it's stigma is pervasive for trans people in medicine. Whether you go to a big LGBT clinic, whether you go to, there are still providers that will stigmatize you. You can go to Callan Lord and they still only HIV screen half of their transgender men as if like they don't have sex. People need to talk about the reality and stop being so ashamed of talking about their sex lives, and stop being ashamed of talking. That's what the beauty of PrEP is to me, is that I'm allowed to come into you instead of coming in and being like, I use condoms every time. And then 2 weeks later in HIV clinic, come in and be like, you know what? I love barebacking. I don't ever want to use a condom again. I don't care if you judge me or not. Just get me on the medicine that I need to be on to keep me from getting HIV positive. I will probably get lots of STIs. Yes, that will be a problem. We'll treat them as they come, but I'm not going to have a lifelong terminal infection. And if we want to get to zero, like there needs to be this dismantling of the shame around sex that exists in this country. And that stigmatizes people as well, that stigma. And they need to completely redo medical education, like from the top down. Because every medical provider coming into any training program, whether you're a nurse, doctor, candy striper, whatever you are in that radio, you still like need to understand HIV prevention. You still need to understand that like people have sex and you're not allowed to just say whatever the fuck you want to people anymore. And you can't treat people differently because they're black or brown or gay or whatever. And I think, you know, I've done all of the education. I have gone to community health centers and with the zip codes that have the highest prevalence of HIV and done 8 trainings for all of the providers on PrEP, and they still don't prescribe it. So like something needs to be dismantled completely, or they need to be held accountable for not doing it. And that's providers need to, like the state needs to start saying to people, if you don't screen people for HIV, then that's the providers. It's your job to screen people for HIV, not to get them to stop doing the stuff that gets them HIV.
Yeah, correct.
You are the one responsible for that. We don't hold providers accountable for not doing their jobs the way that we should hold them accountable, in my opinion. Until we do that and hold them accountable for the words they say that stigmatize people, the behaviors they do that stigmatize people, and then not doing their job, we'll never get to zero. Ever. It just won't happen.
Do you...
Well, and I think to AC's also with the education, I think we also have to hit education earlier as well, because I think like if you look at sex education in general, like I can't tell you how many times, you know, I have like an 18-year-old coming in and I'm like, do you know how to use a condom? And they kind of laugh a little bit. I'm like, no, but really, like, do you know how to use a condom? And they actually have no idea. And we don't talk about gay sex in sex ed. We don't talk about gender in sex ed. And because of that, we have these adults who are engaging in activities that they really don't know anything about, don't know the risk of things. And then they end up in hot water later because they just don't know. And then they don't have an outlet to talk to a physician or a provider because they don't ask about it. And then, you know, 25 years later, we end up having other conversations. And it's like, well, you know, like, I agree, big systemic changes need to happen. But I think, you know, realistically, like, what are the points that that's going to happen? Medical education, okay, great. early sex education in public-private schools, great. But I think it's a lot of education that needs to change.
I think they need to make all medical providers in the state of Connecticut sit on Grindr for a day with a hot picture and see how many times they're asked to bareback, and see how many times a young person asks them for a condom. Make them sit for one day, or make them go out and work on the street as a sex worker for one day and see how much, whether you make more money with a condom or without a condom. And if that's your survival, the providers don't understand the reality of culture, the cultural competence that that exists today. Little queer kids are learning about sex on the internet. On the internet, it's not like two people making love with a condom. It's like Treasure Island, bareback, meth slam, gangbang, porn. It is not this. It isn't like it was when I was growing up. And so it is, and it like provides like for these kids to have to like come into a world of sex. It's just not. We can't expect them to know how to use a condom if the only way that they learn about it is on the internet, and they don't use condoms on the internet. And the little kids aren't reading like all of our models were tested with 4th generation HIV testing prior to the filming of this. No, honey, it's like straight to the, and it's straight to the action. So, I mean, and for trans women, nobody is teaching trans women how to have sex. Mm-hmm. Providers can't even like, I was in the hospital. I have junk. The junk was the problem that I was in the hospital for. And everybody was so stunned that I might want to use my junk. Like, it was as if like, what do you mean you use it? What do you mean you have sex? What do you mean you use that? What do you mean it doesn't work? So you have to take medication to like make it work. And now you have a problem around it. And this is at Yale, by the way. Like, this is at a big academic hospital, right? Not at like, some little hospital in the middle of nowhere. I mean, although New Haven is, but I love New Haven, whatever. I love Yale too, so no shade. But I'm just saying, like, the residents that were there were so stunned that I would want to use the front of my body as a trans woman. It's like, people don't understand how we have sex and how we learn about it at all.
Oof. I don't know which question to go to next. That was so good. I'm gonna go to the stigma question next, because I all of you said stigma at least once. And so my question really is stigma, do you think stigma is getting any better, or is it actually getting worse? Because sometimes I feel like it's getting worse.
I'll start if you guys don't mind. I don't think we ever got over the stigma, to be honest. I think we never got over the stigma, and even though there's people coming up with HIV today, they're still stuck on like, oh my God, I'm going to die. Or who am I going to tell? No one's going to talk to me about, the rejection, this, and that. We're not getting to the place where like, you equals you, and people are, as long as people are stuck on the stigma, or you got HIV, I can't talk to you, I can't deal with you, move my plate, let me go over to the corner, stuff like that. We're going to always be stuck in that. And like, it's a hell of a feeling when you're HIV positive, when people will take anything you use and throw it away, because that's how it was back in the day. If you came into the house and you was HIV, anything that you slept on, ate on, all that was gathered and thrown into the trash. Mm-hmm. And you were asked not to come back no time. You can come back, but not no time soon. They regroup, and so people are kind of still stuck in that place, with the HIV thing. And so like, even the young kids today, they kind of like don't want to go to nobody, and they don't want to tell or want to find out the fact that they're HIV positive. They don't want to have to deal with all of that, And so like, has the stigma changed? Very, very little. I think it's changed very, very little. And if it haven't changed, there's more stigma being dumped on top of that stigma. I know.
So I think I have to check my glasses because I think they're kind of rose tinted a little bit. But um, I think on a grand scale, stigma hasn't really changed much. Like, that meter probably like goes back and forth, but it usually ends up back where it usually is. But I think the way that I like to think about stigma personally is that I try to make individual changes with stigma. And so like coming into contact with somebody as like their healthcare person and they're coming in and they have all these thoughts that are based on like stigma and fear. And my job is to break and change all of those self-assigned stigmas because I can't control the world. I personally cannot change stigma on a grand scale with, seeing like 50 patients an hour. But I can see this one person every so often and I can break down these barriers and I can change the stigma and I can do it one person at a time. And I know when I do that, and then they start feeling comfortable with themselves and their identity and how their identity is not HIV, and then they start breaking those barriers for themselves and talking to their family and talking to their friends and disclosing and feeling good about those things, then I think that's my personal combat with stigma. Because if I can win that battle, then I know that they're going to be able to carry that. They're going to have the resilience to carry that. And then they're going to move it to the people that they love and change, which is a small thing, but that's my personal take on it. I'm not making a grand change in like a societal or systemic way, but I think as individuals and as humans and with our job in like caring for people, this is part of that. And so that's the way that I try to hit stigma, at least in my practice.
I know I work with a group of people. Like I said, I'm the program coordinator for people 50 over living with HIV, and we had a topic discussion yesterday, and I was so amazed, not amazed, not really. It's so frightening to see that people who's been surviving with this HIV for so many years still stuck in the stigma of when they first got it, and how, like, we talk about sex. Just because you're HIV positive doesn't mean you're not going to have sex. And there's people are so afraid to really want to let anybody know that they're HIV positive because, especially in a sexual manner, because the neglect and all of that. And like I was talking to one lady and she says like, I'm just stuck. You know what I'm saying? I isolate myself and I don't want to go out the house to deal with any opposite sex people because, because of this, because of the stigma. And like, and like you were saying, Chris, like I advocate to this community about, look, I get it. Because it took me a while to say, I could tell a woman in a minute, oh, honey, I'm HIV positive. But when I get in front of a male, I'm like, hi, my name is, let's change the subject. You know what I'm saying? And so, like, I get it. Like, but what I've got today, what I've been learning from the information I've got today is like, you know what? When I meet a person, I'm like, and if we're talking on interest of, getting together, do you know anything about You Equal Jew? I don't even have to tell you, here, Google that. You know what I'm saying? And so what I try to do now to let this community know, you don't even have to say much. Give them the information. That way it takes the burden off of you, and but to stay stuck to have a ball and chain on that stigma attached to your leg, it's like we're in a different time. So we gotta kind of bring people along, and we can only do it one person at a time. But rather you do it that one person at a time, you can't just do it once. You got to do it repetitively because people have been living with this thing years and years and years and years and years. How you take that away from them? It's just like it's almost like a comfort. You know what I'm saying? And so like we got to come to a place where we can remove that comfort blanket to give you a new blanket of security.
So I mean, what Chris and Nadine were talking about is, I did that for many years. You get to do it on an individual patient basis. And like, I think working with trans adolescents also, like you get to do it on the thing that happens that is so beautiful is to watch like the parent of a kid who's trans suddenly have to work through the fact that their kid is trans. And then they are confronted not only with the stigma or gay or any of those things, they're confronted with the stigma for their kid.
Mm-hmm.
And if they care about their kid, like they have to figure out they're stigmatized now all of a sudden too. Because like, you know, when everyone's like, well, what did so-and-so, are they getting married yet? And your mom has to be like, yeah, but you know, Chris got married to Tim now. And, you know, like that confronts stigma. And that, I think, confronting it on this like parental level and then having that diffuse across is really helpful to prevent this. Stigma is top down, right? It's the government. It's like the establishment down to us. Somebody made this rule about what was supposed to be like that has nothing to do with me, but it stigmatizes me because I don't fit into that group. But the more like people that say, you know what, like we don't buy that anymore, you know, that's what helps to prevent stigma. But you know, now I decided in my career that I was going to move to a place where I could confront it on a level that is bigger, right? Like we confronted it in Getting to Zero in the commission. Like that was part of the thing that we said, we need to confront stigma. We need to say that it's something that exists, say it exists in medicine, say that we need to change it, and keep saying it over and over and over again until people are tired of hearing us. And then, you know, I work for a company that if you say the word promiscuous, like you are like cast, you know what I mean? Like we don't use that. Like there's language that is what also perpetrates stigma. And when we confront the language of it, that helps with stigma. So like safe is a word that I don't think should be applied to sex anymore. Like, here's the thing, and shared responsibility in sex too. Like, it's not all the responsibility of the HIV positive person to make sure that everybody else is safe. Like, if you decide you don't want to use a condom and you have sex with somebody who's HIV positive who does not tell you, if that person is taking their meds, they're having their part of that responsibility. Mm-hmm. And the other person has to have their part of that responsibility too. And, you know, for all the epidemic, it has all been like the vectorization of the positive person, and everybody else is like the innocent victim of the HIV positive person. And so like confronting language like safer sex to me is, that's your opinion of safe. I have an opinion of safe because I could I've written books on it. You know, like I can tell you what really safe means. But the average person on, you know, an app or in you know, at the grocery store doesn't know. Their version of safe is what the little education they got in 1980, you know, from their parents. And so, you know, all of these like words, and that's what we are trying to do. That's what I try to do. Like when I write, or I go out and do a talk, or I talk to providers, or even when we're writing like white papers, we stop using language that is stigmatizing to people, like safer, like, you know, like those are the kinds of, you can confront stigma at a bigger level, but you got to get to a place where you're not going to lose your job anymore if you start coming for big people and calling out stigma. But it takes a minute to get to that place, right? I mean, I think. And somebody in the government needs to confront it too, right? Like, you know, they need to make Rachel Levine the next Surgeon General. I'm telling you, make that trans woman the Surgeon General of the United States, and stigma will disappear. Because she doesn't care. You can say whatever you want about her, and she just keeps going, doing her job, and does a good job. Stigma, that's confronting stigma. You know, I mean.
Well, wanting to be respectful of all of your time, because I know at least two of you have to run immediately in 2 minutes. For the final question, I just want to give you all like 30 seconds to say what you think people could do right now to help advocate for better health equity for HIV positive people. Like right now, positive or not, what can somebody do? 30 seconds. Chris, you go first.
Okay, so 30-second pitch. I think that one of the biggest things that can change that helps advocate for equity in a lot of these different facets is making room for the younger generation. They are on the ground. They are the ones that are experiencing so much of this, that have the least amount of resources, but they've got a fire in their belly and they want to get involved and they want to start making waves. And I think it is our jobs as a guard of this fight to make room, to help shepherd, mentor, and give them opportunities to sort of get their feet wet, because we're not going to be around forever, and we're going to retire, and we're going to enjoy that beach house in Boca Raton, which I think one of you has. I'm kidding. But I think that we need to make room, and we got to let them grow into our steps, and we need to mentor them so that they can take this up, because it's going to be their job as well.
30 seconds. AC Demidont. What can we do right now?
That's what I was gonna say. Let youth take the reins of these things and just let them and trust them and defend them and stand behind what they say. And when they ask, tell them you're there to help them, and tell them that I'm here. That's what I tell everybody who works at AHI, everybody who's followed after me, Chris Alonso, all of these people who followed after me. I've said, I'm here for you, but you are the ones who have to take the charge. I can't do this forever. You are the tipping point. Like Nadine and I got you to a place. Patrick, you, Christopher, everybody after us, you have to take over. And we have to let go and just sit back and watch and be supportive and curse you out every once in a while, which I've done to Patrick and I just did to Christopher earlier, and pretty much everybody. But trust the youth. They know how to do this. They know how to do it better than us, and how to reach the communities in a way that I could never do.
Nadine, you get the final word.
I agree with both are saying, but my thing is like, I'm so afraid of my community as far as people of color in surviving this HIV thing. I'm so afraid because they're not getting the information that everybody else is getting. So how can we leave them? How can we leave these young youth with the reins if they don't have the information? Mm-hmm. So I think that we need to, as the leaders that we are, we need to start focusing on that. Everybody, every black, brown individual need to be given the same information that they're getting from the top. And I think that we need to teach or show someone that's younger what needs to be done in these communities, and let them, if that's their first job, to pay them to go into these communities, going into these schools, going into the neighborhood drugstores on corner blocks, and let them know about, you can save your own life if you do this. You can use PrEP in, excuse my language, fuck forever. But you know what I'm saying. But whatever I think that's the way that we can get to zero. You can't bring. I agree with Chris and AC when they're talking about if the youth is it. But if the youth don't have the information, we have to be the one to instill that information in them. And I think that's our new route. Instilling this information into the youth so that they can go out there. Like AC said, me and her and Chris, we done all we can do. I can tell you, show you, point you. I can show you if you want to transition, I'll bring you right there. I'll walk you to the door and I'll sit with you and I'll hold your hand. But at some point, you got to know how to walk this walk yourself. Mm-hmm. And so I think that's what we need to do. We need to train these young individuals. If we don't know who they are, gather some. Train them to what, because they're our new leaders. They're the ones that's going to have to deal with this. I've survived HIV for all these years. What are our youth going to do? They may not have the ingredients that I had to deal with this for the rest of their lives. So that's what we need to teach. We need to teach these ones where they're not being counted for, they're not being the new medication, they're not knowing all this information. Those are the ones we need to contact and we need to train. So we have to go, if it means going into a school and look, you may not be HIV positive now. You don't know what tomorrow holds. Mm-hmm. You know, you might just stick it in there, and next day you just blow up. You just don't know what's going to happen these days. So I think we need to train the youth.
Wow. Thank you, all three of you, for this very riveting conversation. I can't thank you all enough. You are all people I love, adore, and look up to in so many ways. And well, Chris, I look down to because he's shorter than me. But no, I'm just kidding. But I feel like I'm at a family reunion today with all of you because you're just family to me. And thank you so much for your words of wisdom and for everything that you do every day to make our community safer, healthier. And I know all of you fight against the system every day, and I appreciate everything that you do. So thank you.
Thank you.
And with that, I'm going to send a view to all of our listeners because I know at least two of you have to run, probably all three because you're all busy people. But thank you, and have a great rest of your day.
It was so